Antibiotics are truly life-saving drugs that target bacteria through precise mechanisms, such as destroying their cell walls, as seen with penicillins, inhibiting protein synthesis, like tetracyclines, blocking DNA replication, as with fluoroquinolones, or disrupting other vital bacterial processes. However, many antibiotics, particularly broad-spectrum ones, do not distinguish perfectly between harmful disease-causing bacteria and the beneficial bacteria in our body. This lack of selectivity can lead to a range of unintended problems, varying from mild and temporary discomfort to severe, potentially life-threatening complications. The most common issues are gastrointestinal problems, affecting approximately 10 to 30% of users. These arise primarily from disruption of the gut microbiome, a condition known as dysbiosis. The intestines host trillions of beneficial bacteria that assist with digestion, produce essential vitamins such as B and K, and shield against pathogens. When antibiotics eliminate many of these helpful bacteria, the microbial balance collapses, allowing harmful bacteria or fungi to overgrow. This often results in nausea, vomiting, abdominal cramps, bloating, and loss of appetite. A frequent manifestation is antibiotic-associated diarrhea, characterized by loose, watery stools due to altered gut motility and reduced water absorption. The most serious complication in this category is Clostridioides difficile, C. diff infection, where this toxin-producing bacterium thrives in the disrupted environment and releases powerful toxins that damage the colon lining. This leads to severe watery or bloody diarrhea, fever, intense abdominal pain, and in severe cases, pseudomembranous colitis, an inflamed colon covered in characteristic plaques. The risk is higher with certain antibiotics like clindamycin, cephalosporins, and fluoroquinolones, and if left untreated, it can progress to dangerous dehydration, toxic megacolon, or sepsis. In most individuals, the gut microbiome gradually recovers over weeks or months, although repeated antibiotic courses can significantly prolong this dysbiosis. Yeast and fungal overgrowth, known as superinfections, occurs through a mechanism similar to gut dysbiosis. The reduction in competing bacteria allows fungi such as Candida albicans to proliferate unchecked. This commonly manifests as oral thrush, white patches in the mouth or throat, or vaginal yeast infections characterized by itching and discharge. In immunocompromised individuals, rare but serious systemic candidiasis may develop. Allergic reactions represent another important category, stemming from an overzealous immune response. The body may mistake the antibiotic or its breakdown products for a threat, triggering an IgE-mediated hypersensitivity reaction. In this process, IgA antibodies bind to mast cells and basophils. Upon re-exposure to the antibiotic, these antibodies become cross-linked, prompting the rapid release of histamine and other inflammatory mediators. Mild reactions include itchy rashes or hives, urticaria, while moderate ones cause swelling or angioedema, often affecting the face, lips, or tongue. In rare instances, approximately 1 in 10,000 cases, the reaction escalates to severe anaphylaxis, a medical emergency involving a rapid drop in blood pressure, wheezing, throat closure, and shock. This is most commonly associated with penicillins such as amoxicillin, with potential cross-reactivity to cephalosporins. Other immune-related issues can include serum sickness-like reactions, fever, joint pain, and rash appearing days later, or drug fever. Certain antibiotics can also cause organ-specific toxicities that vary by drug class. Some, such as aminoglycosides, e.g. gentamicin and vancomycin, accumulate in the liver or kidneys, leading to hepatotoxicity or nephrotoxicity with symptoms like jaundice, dark urine, fatigue, or reduced urine output, issues that are rare but serious, especially with high doses or prolonged use. The nervous system may be affected as well. Aminoglycosides can cause ototoxicity, resulting in permanent hearing loss or tinnitus through damage to the inner ear, while metronidazole or fluoroquinolones may induce peripheral neuropathy, presenting as nerve pain or tingling. Fluoroquinolones carry an FDA black box warning for tendon and muscle problems, as they disrupt collagen synthesis in connective tissues and can lead to tendinitis or tendon rupture, such as of the Achilles tendon. In rare cases, antibiotics like chloramphenicol or sulfonamides suppress bone marrow function, causing low counts of white blood cells, red blood cells, or platelets, which can result in anemia, bleeding, or increased infection risk. Tetracyclines and fluoroquinolones often cause photosensitivity, making the skin highly vulnerable to ultraviolet light and prone to severe sunburns. Finally, macrolides such as erythromycin and some fluoroquinolones can prolong the QT interval on an electrocardiogram, raising the risk of dangerous heart rhythm disturbances like torsades de pointes. While antibiotics remain indispensable for treating serious bacterial infections, awareness of these potential side effects encourages safer and more judicious use. Always follow your doctor's instructions precisely, report any unusual symptoms promptly, and share your full medical history, including any known allergies, before starting treatment.